Wait.
Shh. I hit live already, so hold on. It's just starting up its thing. Hello. So we are live on YouTube today, and this is We Do Women Empowerment, Define the Odds. And my name is Irva, and I have with us Dr. Molara Alexis. She's an infectious disease specialist practicing in Southern California. And here we're back again. I've had her on the channel before. Hmm. Okay, hold on, Molly. I'm gonna stop the video because Sandy can't see us. 1 second. Oh, okay. Sorry, we got a little bit of technical difficulties, and sometimes it comes to the third year of going live. Okay, so if you're having any issues with the audio or anything like that, just let us know. If you're there and you can't hear or you can't see us, just send a message. Whoever has my WhatsApp, send us a message. Okay. So I'm having a little bit of a lag, Dr. Alexis. I'm not sure if if you're picking up on that also.
Sometimes, but now it sounds okay now.
Okay, perfect. If for some reason you're hearing yourself echo, just pause and let it run, and then we'll go ahead. Okay. So I'm just. And I think our viewers are hearing the echo because I got that comment. So sorry about that, guys. I'm not sure why we having that echo. Apparently it's fine now. So my apologies. So go ahead, Dr. Alexis, just take us into your little intro. And this is about, once again.
Hey, thank you, Eva, for having me again on your program. Our program, I guess I should say once more. I'm happy to be here. We just want to kind of have part to the final part of our presentation that we started about two Sundays ago, talking about the COVID vaccine. My goal here is just to provide information. As I said, there's a lot of misinformation, so we want people to be able to make a decision based on facts, not on fear or misinformation. So briefly, as we said last week or the week before, we are saying that there are certain myths that are definitely not true. We are repeating that the COVID vaccine is not the mark of the beast. And listen, if you want to talk more on this, just send us a message that we do, and we like to reach out to you and we can talk more about this mark of the beast. But the COVID vaccine is not that. It is not a tracking system. It doesn't have any enzymes or light to track us. It doesn't cause infertility. It doesn't make us get COVID. Now, to be clear, again, some people, they may be exposed to COVID just around the time of the vaccine. And, you know, based on misinformation, they may presume the COVID gave them the vaccine. But again, it causes you to test positive for the proteins that fight against COVID, but not for the virus. We are saying it doesn't integrate into your DNA. We know that there are the two mRNA vaccines, the Fisa and Moderna. Last time we said that this piece of RNA, messenger RNA, is not in the nucleus. It is in the cell, but not in the nucleus. And the body uses that to make the proteins that are present on the SARS-CoV virus so that immune system is primed when it comes in contact with this virus to recognize it. So the mRNA doesn't enter the nucleus, and it's destroyed immediately. So the other vaccines, which I specifically want to say, the viral vector vaccines, like the AstraZeneca and the Janssen, I want to make that distinction because last time I don't think I did make that distinction. So the viral vector vaccines, they have DNA. So the DNA does go to the nucleus, but after it is used to make the messenger RNA, which makes the protein that's present on the cell, that same protein that's present on the cell of the virus, it is broken down. That DNA does not enter into our DNA. So I just want to clarify that. Also, I want to do justice. Someone last time had asked a question, and they were asking about why, when you take a test for COVID, you have to quarantine 14 days. And the way I answered that, I think I was talking about isolation. So basically, the 14-day period is thought to be the incubation period. So if I get exposed to somebody with COVID now, between, let's say, from now to 14 days, I likely develop symptoms. Normally, it doesn't take up to 14 days, generally around 4 to 5, but that's the duration. And some authorities are saying probably it doesn't need to be so long, but technically it's 14 days. And so that's the quarantine. And the other part that I was talking about was actually the isolation. When somebody has that confirmed COVID, how long do they need to isolate for? It is 10 days. 10 days, as long as you don't have any new symptoms, no new fevers, and it's not a severe case, it's just 10 days. Your immune system is intact 10 days. So I just wanted to clarify and make those points. And now let's have some questions. Let's help ourselves to better understand what's going on.
Mm-hmm. Thank you very much, Dr. Alexis. And sorry, I know it seems that I'm having a bit of a feedback too, so I apologize for that from our viewers. If you're hearing the feedback, I apologize. Okay, so now we'll just go, and Dr. Alexis, do you want me to do one question at a time or read a few?
You can read a few and we'll take a few questions.
Okay. Mm-hmm. And I'm hearing the bing on my computer, but I'm not sure why. So I'm guessing it's probably comments or something, but I'm not able to see. Okay. So the first question we had, can't we just depend on our immune system to end the pandemic? And that was one of the comments that came on the chat from the previous discussion we had.
Okay, can we depend on the immune system? And so we are thankful to God for the immune system that he gave us. And we believe that there are things we can do to boost our immune system. For example, we believe that medical science bears this out, that a plant-based diet is very effective in boosting the immune system. So certainly, I would encourage persons out there to have a plant-based diet rich in foods like fruits and mixed vegetables. They have a lot of phytochemicals to boost the immune system. You get your minerals, you get antioxidants to help the immune system, reduce oxidative stress. You go to the sunshine, you get your vitamin D, you exercise, you make sure you're low sugar diet, because sugar is not at all a friend of the immune system. Low fat diet. You get enough rest, you de-stress, oxygen, and all of these are good for the immune system. But, you know, unfortunately, we can't just depend on this to end a pandemic. And so some people, despite their best efforts with diet, exercise, and everything, they may, for example, I might be doing all of this and I get COVID. I may not get it in a severe manner because my immune system is probably good. But then I can be passing it on maybe to a family member whose immune system is not as good, maybe because they have diabetes or because they're older in age or they have hypertension. So we have to remember, I'm not just protecting myself, I'm also protecting other people who, for other reasons, maybe they have lupus, they're on steroids, their immune system is not as good. So we have to understand that the immune system, as much as we are promoting that we should have a good diet, we should exercise, we should rest, we should trust in God, have that day of rest as he has said in his word, we are saying that there's things that we can do to help ourselves from getting the COVID and also from preventing it. And as I said last time, there's also a possible genetic link that possibly may explain why some people who are healthy, sometimes not as common as those with comorbidities, do get sick too.
Okay. Okay, so thank you very much. And I'm happy to know, because I know people are concerned. They're saying they're healthy, they're exercising, they're having the vitamins, they're in the sun. So they can't see the need to get the vaccine or believe that it wouldn't get COVID. So thanks for clearing that up. And I like the fact that you said it's about protecting others too. So thank you.
Yes, protecting our grandparents who are older. And with age, our immune system goes down. Protecting another family member with diabetes or somebody who's on steroids for some kind of ailment.
Perfect, thank you. So the next question that I have here is, does the vaccine destroy our immune system? And that was also a comment that came in from our last discussion. So can you help clear that up for us?
Right. And some people, unfortunately, and there's a lot of misinformation, believe that the vaccine is destroying. What the vaccine is doing is stimulating or priming the immune system so that it will know how to respond to the virus. So the immune system has B cells that produce proteins or antibodies. These proteins or antibodies prevent the virus from binding to our cells, to enter our cells. And the T cells, they have killer T cells that destroy infected cells. And they also stimulate antibody production. They stimulate rather the B cells to produce these antibodies. So when we take the vaccine, we are giving our body a chance to be familiar with a portion of that virus that is important, so that we can prime our body to make antibodies, the proteins that destroy the virus, and also the killer T cells. So we're actually priming our immune system to prepare it for battle. We're not destroying it.
Thank you very much. And as I said, if you have any questions, please put it on the comments, keep it coming. We'll try to answer as much as we can. Another question that came in before is, why get a vaccine if 90%, if it's not greater than 90%, if 90% of the people recovers from COVID? So why get a vaccine if 90% of the people recover from COVID?
All right. Another thoughtful question. So yes, we are not saying that everybody who gets COVID has a bad outcome, but we have to look at the numbers. You know, we have to look 90% of what? Is it 90% of 10 people with COVID? But when we look at the CDC website or the Johns Hopkins website, it's informing us that we are having millions upon millions of people who are having the COVID, and that we know so far that about 3 million people have died. So it may seem like a low percentage of people who have died if you say 2% died or whatever that percentage is, but it's 2% not of 10, it's not 2% of 20, but it's 2% of billions. And that 2% represents people who should be with us today, but who unfortunately their lives were cut short with COVID.
Okay, so you mentioned the CDC and Johns Hopkins. Could you explain those websites? Is it something that's available to everyone?
Yeah, so the CDC is available to everyone. It's actually a great website to get accurate information about the symptoms of COVID. You can track cases, you can read about variants. Johns Hopkins has also a very good data tracking where you can see in each country and so forth, the number of cases, the number of deaths. So that's, I highly recommend, people to look to the CDC, also World Health Organization. They're very reputable sites to get accurate information.
Okay. Oh, so thank you. So good to know that. So guys, ladies, and all my viewers, if you want additional information or if you want anything health related, you can check the CDC website, Johns Hopkins website, or the World Health Organization website. So I'm going to go into another question. Why vaccinate young and healthy people since they would likely do well? The average age of death is about 70 years with comorbidities. And before you answer that, I'm going to say, because I know now in Canada here, it's the vaccines opened up to, I believe, 12 and older, or something, 12 to 15 or something like that. So can you shed some light on that? Because I am, as a parent too, I'm quite concerned.
Okay, yeah, and so we acknowledge that younger people without comorbidities are not as sick. In most instances, young people who are healthy tend to have a better outcome than an older person or a younger person even with comorbidities. So, for example, if you I was looking at a MMWR, that's Morbidity Mortality Weekly Report from the CDC. And they said, like, from February the 12th to July the 31st, 2020, a 6-month period, there were about just 121 people who died from probable or confirmed COVID or complications of COVID. So I guess somebody could look at that and say that's not a lot. And then when you hear that about 30 of these people were healthy people, you might say, well, why bother to vaccinate them? Well, one thing is that these people who died, there was somebody's child, there was somebody's cousin, there was somebody's sister. So one death from COVID is too much. And the other thing that I want to say is that even though these people are healthy and they may not have severe symptoms, they may still have the COVID. They can still contract the COVID without symptoms and pass it on to more vulnerable members of our community.
So thank you. And I love that point. A life is a life, right? Whether it's 121 persons, every one person that died in that 121 is someone's child or daughter or son. So it doesn't matter the number, it's still someone that passed away. The other thing you said, which is important, that young people can still contract it and pass it on to someone else. So thank you for that. Guys, I just want to say also to my viewers, if you have questions, you can send them via the chat, or you can send them to me. Continue sending them to me. It's via my WhatsApp for those who have my WhatsApp out there, or we do 7806@gmail.com. Okay, so Dr. Alexis, I'm going to ask you another question that came in before. How do mRNAs vaccine work? I know you spoke about it before, but can you just give us a little more insight and elaborate a little more if you can?
Oh, definitely. So in the past, we had different vaccines. So we had, for example, weakened vaccines, for example, the measles, mumps, rubella, So we had what you call weakened vaccines, and then you also had kill vaccines, which we would introduce into the body, and the body would be primed to be able to destroy the virus. So in the past, we have used a portion of the virus or we have used a weakened form or deadened form. So these are the kind of vaccines that we generally know, particularly people from, well, all of us, because this mRNA vaccine is a new one, we would know of these kinds of vaccines. So what the mRNA vaccine is, it's not, instead of giving the person a weakened form of the virus or a killed form of the virus, you are giving them the messenger RNA, which is like a photocopy. It has instructions of how to build not the entire virus, but part of the virus. Remember, the SARS-CoV virus has it's these spikes that are called the spike proteins that are used to enter the cell. So the mRNA, when it gets into the cell, it gives instructions so the cell can make that protein that is on the surface of the virus. So therefore, the body's immune system can learn how to produce the weapons to destroy it. So you're not giving the person the virus, you're giving them instructions of how to build the protein that is on the virus. And by doing that, your body knows how to produce the T cells, which kill infected cells, and also to produce the B cells, which make antibodies. So that's the mRNA vaccines. And that's Pfizer and that's Moderna. You're giving them a copy of instructions of how to build the proteins on the surface of the cell. And then when that is done, that messenger RNA is degraded. The viral vectors, on the other hand, like AstraZeneca and Janssen vaccine from Johnson and Johnson, what is done is that you get a weakened form of of a virus, not the COVID, not the SARS-CoV virus 2. You use like adenovirus. That's what they use. It's a weakened adenovirus that cannot cause disease in the human being. And in this weakened adenovirus, you give it the DNA, the genetic material, to also make that spike protein, the protein on the surface of the cell. It does enter the nucleus, but again, it's not integrated into the human being. So basically, instead of providing the virus to the person in a weakened or killed form, you're given the instructions of how to build part of that. And as I said last time, this mRNA technology is not new. The mRNA vaccine is new, it's our first, but the technology, it has been studied for decades, and it has been used for other, therapy. It has been used for cancer therapy, studied for cancer therapy as how you can cure, and also for other viruses in trials. And there's a misconception, I think, where some people feel it has only been studied in animals, but it has been studied, as has the viral vector vaccine. They have been studied in human beings, but we acknowledge that this is the first time we have the vaccine, but actually the technology behind both these vaccines are not new, and they have been studied in human beings before. We do agree that this is probably the largest clinical trial with these vaccines, but the technology is not, it's definitely not new at all. So for example, the viral vectors, I think it's the 1970s, and the mRNA, at least 2 to 3 decades it has been around.
Okay. Thank you for that. So I have a question that came in, but before I get to that question, you mentioned a few things, because I know a lot of people are still concerned that it's it's DNA changing, which I believe is one of the questions that's here. Would it change my DNA? And you sort of touched on that. And still people are under the misconception that it's being introduced. It introduces the actual virus into our bodies. So thanks for clearing that up.
Yeah. I do want to say, so the World Health Organization has authorized an inactivated form of the virus. That has not been used in all countries, but I do want to say that there is a COVID vaccine that uses a weakened form of the virus. But I'm saying that for the viral vector proteins, the AstraZeneca and the Janssen vaccine, it's not using the SARS-CoV virus 2. It's using a weakened form of an adenovirus, a virus that causes the common flu, and it's not using the virus that causes COVID. So as we said, like in the past, when you had, you needed to get immunized for measles, mumps, rubella, you would use a weakened form of the virus. It's called attenuated for measles, mumps. And we have had, most of us have had that. And for polio and hepatitis, you would give an inactivated or killed form of the virus. So now we are not doing that in these 4 vaccines that we are talking about here, but we are giving information to the body to actually produce part of the virus and not the whole thing, just the protein that's present on the cell. That protein that's present on the cell is actually the key of that not the cell, the protein that's present, on the SARS-CoV virus 2. That protein there is actually the key that the virus uses to unlock so it can come into our cells.
Okay, wow. Thank you. I felt like I was in biology and chemistry 101 and med class 4th year. Thank you very much, though, but you made it very simple. Thanks for clearing that up. I'm going to ask, and that wasn't a question, and I have some questions that came into, but what I wanted to ask, though, is what's the benefit, though? Because most of the viruses, the vaccines, then they would inject us with a form of the virus, and now you're saying with the mRNA, it's an adeno form, if I got that word correct, of the virus. Is there any benefits to the mRNA versus the kind of vaccines that we had back then?
Yeah, so that's a beautiful question. So mRNA technology, it's rapid. So when you had to use the MMR vaccine or the polio, you have to grow all these viruses because you vaccinated thousands and millions of people. So you have to grow the virus and then you have to kill it and get it to weak. That will take a time to be growing all these viruses. We're not just getting viruses for one country in the Caribbean, we're getting viruses for the whole world. So with the mRNA technology, you can rapidly produce all of these strands of mRNA to distribute. So you don't have to depend on growing the virus and then inactivating it. So it could be very rapid. Also, it's non-integrated, meaning that it does not enter the person's DNA. It's not infectious. That mRNA part is not infectious. It's just producing a part of, it's producing the protein that's present on the SARS-CoV virus. So therefore, it's not introducing the SARS-CoV virus into your body, the whole part of it. So this is the advantage of this technology. You're able to produce large quantities of vaccines because you're not having to be growing the viruses and then weakening them and things like that. It's very, very rapid. Very rapid. It doesn't integrate into your DNA. It's destroyed by the cell. It's safe to administer. That's an advantage.
Okay, perfect. So I'm going to read, I know we had some that came in first, but I'll just read a few of the chats. So one question is, any updates on those folks that took AstraZeneca vaccine, which is now on pause in Canada? Are they able to take an mRNA vaccine, or I guess another vaccine? The persons who got the first shot, can they now take another vaccine?
Okay, so that's a good question. I believe the authorities now are studying what's the best thing to do. So first of all, to address the AstraZeneca situation, as we said last time, the viral vector vaccines, this Janssen vaccine produced by Johnson and Johnson, and also the AstraZeneca vaccine, sorry, just excuse me. Both of these vaccines have a very rare incidence of blood clots. It's not very common, but it has occurred. And some authorities in some countries have decided that they would want to use another vaccine. The World Health Organization has said that countries should weigh the benefits and risk. It's not thought, but it appears as if the risk may be a little higher in younger people under 50. In the United States of America, the CDC has determined that based on the available evidence, the benefit of the Janssen vaccine far outweighs the risk. And so the question is, which was the original question before I went off on a tangent there, was that with the AstraZeneca, the authorities will do studies to see which is the most appropriate vaccine to give at this time. We would have to wait on their studies to find out what they would offer. You know, if a person already has the first dose of AstraZeneca, what can be offered? So we'll just actually have to wait and see what they find would work. Here, you know, in the United States with the Fisa and Moderna, they do not recommend to interchange. Like, okay, my first dose is Pfizer and my second dose is Moderna. They recommend to keep keep the same vaccine. There are some very rare circumstances where that may happen, but they generally recommend to keep the same vaccine.
Sorry. Thank you, viewer. I hope that answered your question. And if you need any elaboration on it, just send another question. We have some other questions from the chat. Besides the vaccines, please share any other preventative measures people can take.
Okay. All right. So that's a great question. We talk a lot about masking and social distancing. These are very important. Hand hygiene and environmental cleaning. These are important things that we can do because we know that this virus, majority of the cases acquired by inhalation. So masking, social distancing, hand hygiene, not touching your face if you touch objects, things like that. Again, we are also saying the things that we can do is to promote immune function by diet. As medical science has borne out, a plant-based diet is better than a diet that is laden in sugar and fat and processed foods and a meat-based diet in promoting the immune system. Plant-based diet filled with phytochemicals, antioxidants to boost the immune system. Getting enough sunshine so we can get vitamin D. Vitamin D is really good to help boost the immune system. Air, trust in God, trust in divine power. We can't solve every problem. We have to just give Jesus, let him help us because we can't make it in this earth on our own. Exercise. In the Western areas, sometimes we do a lot more driving than walking. So exercise, at least 30 minutes of exercise for at least 5 days a week, that is recommended. Drinking enough water, not soda and juice, drinking enough water. And hydrotherapy may be a benefit, hot and cold showers and so. So these things we can do to help our immune system. But we are saying there's the feeling that, if you take that vaccine, some people feel that way. I'm not saying everyone, that you're not displaying trust in God, just, diet. And I am saying diet, water, trust in God, getting rest. He gives us a day of rest every 7 days. All of these things are good. But in addition to doing that, the vaccine is also very important. And also the measures of wearing the mask and social distancing and things like that.
Mm-hmm. So thank you for that. And I mean, it seems like it's the basic things that we should have done, eating healthy, more plant-based diets, not doing the sugars and the sodas. And for ladies, that keeps us, looking great. Look at Dr. Alexis, right? I'm going to assume, I know she runs a lot, so she's looking good still. So ladies, it's simple things, preventative things that we should always be doing before we get to a pandemic that should keep our immune and rest, a day of rest. So for us, we rest on Sabbath. The other, I know other religions, they rest on Sunday. But for us, the day of rest, God gave us a day to rest, guys, take it. Rest and eat healthy. And the vaccine is needed still for prevention.
Yes.
We have another question. I'm going to go back to the chat in a second, but we had some other questions. Does the vaccine, I think you answered that one, sorry. Does the vaccine alter my DNA? I believe you had answered that one.
Yes, it does not alter the DNA in any case. The mRNA in the cell cytoplasm, nor the DNA from the viral vector vaccines, even though it's in the nucleus, it does not integrate. It's not integrating.
Okay, so that would lead me to a question that I have, and not that I'm in childbearing age, but for women who's taken the vaccine, is it safe for a person who wants to become pregnant or, or planning to be pregnant in the next few weeks or months, or you happen to be pregnant later on, if you take the vaccine, is there any risk factors in being in childbearing or being pregnant and having the vaccine and those stuff?
No. To be honest, when they did the trials, they did not enroll pregnant women. Mm-hmm. But during the phase of the trials, things happen. People mm-hmm. get pregnant, and they did not determine any adverse effects in those who became pregnant. So although they did not have like a large percentage of pregnant people that they can actually study on. There were some pregnancies and they did not detect any adverse effects. So pregnancy, being pregnant at the time or planning to be pregnant in a few weeks or months or so is not a contraindication for the vaccine. There's some live vaccines and there are other vaccines that may not be safe, for example, in people who are immunocompromised or maybe pregnant and things like that. But these, the Moderna, the Pfizer, AstraZeneca, and Janssen vaccine, we don't have information on that being a problem in pregnancy.
Okay. Another question from the chat, sorry. Hang on, let me just get it here. Sorry, I'm not wearing my glasses. I should exercise and eat a little more healthy so my eyes will be better. Many of us are concerned or think that taking the COVID vaccine would suppress our natural immune system and cause issues down the road. Can you comment?
Yeah, so no, that is not, I mean, I can see how someone may think so, but scientifically that is not correct. What we are doing, we are teaching our immune system how to respond to COVID by giving it a part of that SARS-CoV virus. So we are giving it the protein that's present, the spike protein that's present on the surface of the cell to show it. This is how this virus looks. Anytime you see something like this come, destroy it. Yes. And so we are priming our immune system or teaching it how to respond to the virus. We are in no way destroying the virus, not at all. Not the virus, we are nowhere, destroying the immune system.
Okay, so we're giving our body a little boost. When you see this virus, this is what you need to do. We're not saying that we're going to suppress our body's own immunity. That's not what the vaccine's doing.
No, it's teaching our immune system to recognize the virus and to be able to respond. That has been the thought behind all the other vaccines, whether it is the MMR vaccine, it's the chickenpox vaccine, it's the polio, whatever the vaccine, influenza, we are introducing it, we're introducing our immune system to the enemy and say, listen, whenever you see this enemy again, destroy it.
Perfect. Okay, so I'll get back. I have a few questions that came in, but I'll get back to them. Another question that came in before though, what is the risk of blood clot with Johnson and Johnson and AstraZeneca?
All right, thank you for that question. With the Johnson vaccine, there were about 8.7. So this data is within a few weeks data. All right. Johnson, which is the Johnson and Johnson, it's 8.7 million doses were given. And of those doses, they had 28 cases of the clots, the thrombosis, and 3 of them were fatal. So 8.7 million doses, 28 cases. And so what they have determined from that, for a woman between age of 18 to 49, the risk of getting a clot from the Janssen vaccine is probably 7 to 1 million. So for every 1 million doses, maybe 7 people. For those women who are older, 50 years or older, or for men, the risk of getting a blood clot from the Janssen is probably less than 1 to 1 million. So for some reason, it's as if it may be common in the younger women, but we don't have, we haven't been able to identify a risk factor. For the AstraZeneca, in the European Union, for every 100,000 vaccines, every 100,000 doses, there you have one clot. That's the approximate ratio. In the United Kingdom, after giving 21.2 million doses of that AstraZeneca, about 7.9 persons having a clot to 1 million. So for every 1 million doses you give, about 7.9 clots. So as we see, it's not very common. When you think of millions or 100,000s, it's not very common, but it does occur. And so that's why the Janssen vaccine, there is an update on the EUA where people are advised, particularly women under 50, just to know that there's a small possibility of that. The World Health Organization also says that the AstraZeneca vaccine the benefits could be greater than the risk, but you have to weigh everything. What is the incidence of COVID, meaning how rampant is the COVID? Does the person have comorbidities? Are other vaccines available? And these are what individual countries are doing when they make their decision to use it or not. They are looking at the incidence of COVID, the new cases of COVID, are the vaccines available, the comorbidities of the people, things like that before they make a decision. And also the case.
And I have a few questions that I'm going to go to, but because we were on the topic of the AstraZeneca and the blood clots, from the last stats you read, I realized it increased slightly from the last time you were on. But I know in the Caribbean and Grenada, for example, because I'm from Grenada, that AstraZeneca, and I have some Grenadian viewers right now, AstraZeneca is the vaccine that's being offered. I know the incident with men is very small, but how would you encourage a female, because every life is a life, that, 6 point something is someone, right? So how do we tell someone where that's the only option they have, that it's okay to go ahead and take a vaccine?
Yeah, so here we as healthcare providers, we like to, and we do this every day as we go to work, we weigh the benefits and the risk. If I give this medication, it's going to help this person, but maybe it may do this to the kidney. So these are things we have to do every day. So there are some countries where AstraZeneca is the only option. There are other countries where you would have, for example, Canada, they may have Fisa, Moderna, so you can choose. So the question is, when there's this one option, what do you do? And so things that you have to consider is, listen, how is COVID shaping up? You can look around and see how it's shaping up in India, how it's shaping up in some Caribbean countries like Trinidad. So you look at the risk of COVID that's present. You look at your own risk. Am I older in age? Am I diabetic? Do I have asthma? And, you can be able to determine that, COVID is still rampant, maybe not as before in particular area. For example, where I'm at, it's a little better. But then you look at the general trend of COVID and you look at your comorbidities, and then you also think that, listen, if I end up getting COVID, I could have a clot too, because clots from COVID are actually more common than clots from the vaccine. You can get clots to the brain. So we, especially in that last surge here, we saw patients with clots. Sometimes they would have blood clots to the lungs, clots to the legs, clots to the brain. They would get a stroke. I didn't particularly see, but I read reports of patients getting clots in their arteries, leading to limb ischemia, where the limb is dying. So you have to think that COVID too can cause these clots. So you have to weigh the risk and then the benefit. If you think, okay, I don't want to, maybe there's a risk of a clot from this vaccine, but there's a risk of a clot from COVID, I may be at high risk. But we do acknowledge that even the CDC has stated that, women under 50, they should be aware that there may be a smaller chance of, although the overall incidence is low, they may be at a slightly higher risk. But again, if you are in a place where there's not another option, you need to kind of think, the risk of COVID, it could give me blood clots, it could shut down my kidney, I can go into respiratory failure, I can pass it on to somebody, maybe at higher risk, and then kind of think, I better go with this vaccine because the risk of getting COVID is probably worse than a risk of smaller percentage of taking the vaccine. So you weigh the risk and benefits, but we do say that everyone has their individual choice, and there are instances where people may opt for an alternate vaccine, and if that's available, it could be done too.
Wow, thank you. And I guess because we're not medical professionals, I didn't know you can get a clot and all this stuff from COVID. So I get what you're saying is you have, in everything, you weigh the risks, the pros and the cons. And that's kind of how I made my decision too. I thought about the symptoms and the risks of getting COVID and the chances, the small chances of something happening from the vaccine. It seems like the risk of COVID was much, much, much higher. So thanks for clearing that up. Another question is, if the AstraZeneca vaccine is being used in the US, is it still being used in the US?
Okay, so the AstraZeneca vaccine is not authorized for use in the United States. However, I believe the CDC recognizes that this vaccine is approved by the World Health Organization. So if someone had the 2 doses of the AstraZeneca vaccine in, say, Canada or England, and they come to the US, based on the information that I got, the latest information, they will not be required to take another like Moderna or Pfizer or something like that. But because they have had the 2 doses of one that's authorized by the World Health Organization, they will not make them to take over the series, but it's not given here in the United States.
Okay. So I hope that answered your question, viewer. Another question is, can you still get COVID if you take the vaccine? And that question came in a few times, and it came in before. So can you still get COVID if you take the vaccine?
Yes, very good question. So no vaccine is 100% effective, not just the COVID vaccine, but no vaccine. But what the COVID vaccine does is reduces your chance of getting the disease, or if you get it, reducing the chance of getting severe disease where you need to go to the hospital or the ICU. So there's still a possibility after the vaccine that you may get it. But getting the vaccine would reduce, and this is what we are seeing, it would reduce the chance of you getting it, and it would reduce the chance of, even if you get it, you would not get it very severely. We are pointing out also that there are a lot of variants. And let me put another plug in for vaccination here. The quicker people get vaccinated, it means that this virus has less time to circulate and less chance to form more variants, because each time it changes. When we say we have a variant, we mean it's changing the proteins on the surface or some of the amino acids on the protein. As we get the vaccination, we are given the chance, the virus, less opportunity to form more variants. And we all know about the variants from the UK, South Africa, Brazil, and India. Now, again, I want to say that the vaccines, the variants may reduce the efficacy of some of the vaccines. And we have studies showing that different vaccines have different efficacy rates with the variants. But even though they would reduce it, the thought is that it would less likely to reduce it to 0. So maybe if it were, for example, the efficacy rate was 80, maybe it may come down to 60 or 50, but still having some protection is good. And I think last time when I mentioned the original vaccine, I meant to talk about the Pfizer vaccine. So for example, the Pfizer vaccine, they noted that it was still had some decent efficacy against the UK variant. And again, they noted it had good efficacy in the Middle East, in the country of Qatar. It had good efficacy against the South African variant. The AstraZeneca, good efficacy against the new UK variant, which is the B117. Not as good against the South African variant in terms of mild to moderate COVID, but we're not sure about severe COVID. So again, different vaccines would have different efficacy rates, but the hope is that, and likely it would not reduce it to like no effect at all. And again, the sooner we get vaccinated, the sooner this COVID could be under control, and we won't have more variants circulating to cause us heartache and distress.
Mm-hmm. Mm-hmm. So, okay. So I wanted to, because you mentioned efficacy a few times, and I wanted to, before we talk about that, I wanted to ask, because here in Canada, we're not getting it as fast as it's coming in the US. So our second dose does it. Is there any issues? I think Pfizer, because I got Pfizer, it should be about 21 days after. You can correct me in a bit if I'm wrong, but now they're sort of delaying the times that we can get them. Is that an issue? Would that make it less and less effective by the time I get my second dose in 16 weeks, for example?
Yeah, so good question. So that was something that we had to think about. For example, like, say, for example, I get in contact with somebody with COVID now and I get COVID. And the same day that I get the vaccine, I get in contact with COVID. Then I go to the healthcare center and they give me a particular treatment for COVID called monoclonal antibodies. These are proteins against the SARS-CoV virus. So we are told that, for example, when somebody has been given monoclonal antibodies, that we should delay the second dose of the vaccination by 90 days. So that's an example of where you see a delay in the second dose.
Okay.
The person got monoclonal antibodies, proteins against the virus. So that recommendation in that instance is to delay it by 90 days, although it's not within the period that is on the fact sheet and so forth. We still believe that it would work and it would be effective to a good degree.
Okay, because I know a lot of us here, well, I am quite concerned, like, oh my goodness, why can't I get my next shot within the time frame? I don't want to lengthen out this thing, and then in 90 days, I have a bit of a problem. I have to start all over again. So thanks for clearing that up.
Yes, it's
another question.
Say there are instances where it's delayed. It's always good to do it as recommended, but it has been delayed for different reasons, and you don't have to start over again from scratch.
Okay, thank you. Another question. What is the difference between EUA, which is, I guess, emergency use approved, I'm assuming, and FDA approved?
Okay, very good. So emergency use authorization is given to a product when it is deemed to be safe and effective under a time of duress, like a COVID pandemic. So before you could give a medication to someone, I can't just make up a medicine and boil up some bush and call it a medicine. It has to be studied. And so there's the first trial called the phase 1, where you have a few participants. You look to see, is this thing safe? Is it causing the immune system to respond? And then the second phase, that's where you probably have hundreds of participants. And then in the third phase, that's where you will have thousands of participants. You're looking to see, is it safe? Is it effective? And so forth. Now, normally with FDA approval, now I will give you the general overview. There probably would be other details that other experts in this field can add. In the EUA, you finish the phase 1, where you deem that it's effective, it can boost the immune system, cause the immune system to respond, it's safe. You do the phase 2, then you do the phase 3 trial. So for example, with the Pfizer, Moderna, and so forth like that, the phase 3 trial was done, and the FDA would require you need at least about 2 months of follow-up, a medium follow-up of about two months. And the reason why this is done is it's believed that within 2 months period, most of the side effects, if not all of them, would be seen within a 2-month follow-up. So at the 2-month mark, they looked at the data, they said, okay, it's safe, it's effective. These are the common side effects. This is how the body is responding. It's studied in a large number of patients. I know under maybe ideal conditions, we'd probably want to look at it a little bit longer, but because we have sufficient data, so they're not cutting corners and saying, oh man, time is up, we don't want to look at it anymore. But because we have sufficient data to prove that safe and effective, even though in normal circumstances, we probably would look at it a little bit longer, but because we have so many people in the studies, and because we've had at least 2 months of follow-up there, we think that because of the seriousness of the pandemic, we can feel that it is safe and effective. If it weren't a pandemic, maybe they'd want to study it out maybe for 2 years or so like that. But because it's a pandemic and it is deemed that the information at this time can be not guaranteed, but most likely safe and effective, from what they can see, that's why an emergency approval authorization was given. And then even with that, even with an emergency approval, the people in charge of the trials, they have to make sure they continue to monitor for side effects and safety and efficacy, and to report these things. So it's not just done there and that's it, everybody go home. No, you have to continue to look. And as I said last time, with the participants in the trials, the Pfizer, there were like 21,000, a little over that in the vaccine arm, and then a little over 21,000 in the placebo arm. That's where they don't actually get the vaccine. Again, for the J&J, it's like about 19,000 in the vaccine versus the placebo arm. And so, in these trials, there are thousands of people. And by now, we would remember that there are millions of people who receive the vaccine. So by now we would have so much information about possible side effects from these vaccines.
Okay, so another question that came in here, talk around town, taking the vaccine will eventually become mandatory. Do you have any comments on that? So what do you think about that? Your opinion, I'm guessing.
Yeah, so the question is, how do we balance people's personal decision? You know, everyone has a right to take, not to take an intervention. You know, like I might be diabetic, and if I decide I do not want to take insulin, that's my right. It might kill me, but it's my right. Now, that's not a sensible thing. And as a physician, I am not recommending anybody to just stop their medication. I'm just giving that illustration. So it's a person's right to choose or not to choose an intervention. Now, we also have to balance that with what my choice does to somebody. So, you know, if I decide I want my sugar to be 10 million, it's not a public health crisis. It is a sad thing, and it's a crisis for me, and it probably would affect other people around me, but it's not a public health crisis. In the COVID situation, the decisions of thousands of people to take or not to take the vaccine will affect the good of the country or not, or the suffering of the country, so to speak. The question is, are you asking me, Malara Alexis, should there be a mandatory, should you say you have to take the vaccine or go to jail? Is that what you're asking?
I think the person's asking, if I'm wrong, they can probably send another comment. Do you think that the government legislations will be passed that will have to take a vaccine? But based on what you're saying, it's a human right. It's against human rights to say.
Well, every person should be able to make a decision whether or not to take the vaccine. But I have that right, but I also have to think about, so I have to balance my right with the good of my community. So this is a very ethical question. You have to balance my right to take or not to take an intervention with the good of the community. But then again, we are living in a democratic society where we would not want governments to be mandating things. So this is a very ethical question, which would take a lot of discussion. My hope is that we would never reach to a situation where the government would have to mandate it. And I am not, I'm not wanting that to happen. I'm not supporting the government. If you're asking me, yes or no, should the government mandate the vaccine? I would pray not. I would hope not. Yeah, I would pray and hope not. I wouldn't want to see a situation where people are being forced to take a vaccine. This is not something that I think that is good. But I do want to encourage people to take the vaccine. It's been shown to be safe and effective. But again, I am not in support of, a government clamping down on its citizens and take this vaccine. If you don't take this vaccine, this is going to happen to you. I am not in support of that, but I'm just encouraging people to continue to look at the information and make that decision for your health and for the health of your community to take the vaccine.
Thank you. Thanks for that answer. And yes, I think it's ethical, but I love how you ended. It's a good decision for you. Think about you and the health of everyone else around you. Another question, is it safe to take the vaccine if you're diabetic?
Definitely, because diabetics are at a higher risk of comorbidities, diabetes, obesity, asthma, COPD, sickle cell disease. These are high risk for having severe and critical COVID. And if you have diabetes, I am encouraging you to be at the vaccine center 8 o'clock tomorrow to receive your vaccine, as long as you have no contraindications. And what are the contraindications? If you have an allergy to any of the ingredients of the vaccine, you can look it up at the CDC website or the website of your country. If you have had a previous immediate reaction to the first dose, you're not to get the second dose. But barring that, be at the vaccine center 8 o'clock tomorrow to receive your COVID.
So you should be one of the first persons there. That's what you're saying, as long as you doesn't have contraindications. Another question, what is the difference between the Fisa and the Moderna vaccine?
So they have the same kind of technology, actually. So you have the workhorse. The workhorse is like what does the job. So if you have, for example, well, maybe I can give a Caribbean example. The soy milk is the workhorse, and then you put some cinnamon in it and something to spice it up, and okay. So the workhorse of the vaccine is actually the messenger RNA. So both the Moderna and the Pfizer have the messenger RNA, and then it's surrounded by a lipid capsule. The ingredients may not be the same. Rather, the lipid capsule ingredients may not be 100% identical in each case, but the workhorse, which is like that soy milk that you're drinking there, or that almond milk that you're drinking, or that cinnamon bush tea, that messenger RNA there, that is the workhorse that provides the instruction to help produce the protein, that's present on the virus. So the lipid, what surrounds that from the Moderna and Pfizer may not be 100% identical, but what's inside of it, it's the same concept.
Okay, thank you. So I hope that answered the viewer's question. Does the vaccine mean I will not, I think you answered that. Does vaccine mean I would not get COVID? You did answer that one. Didn't they do an mRNA studies in animals? And I think you touched on that too, the mRNA.
Yeah, so they did it in animals, and normally you kind of do animal studies and then you do human studies. Some people are feeling that they just did it in animals, but I just wanted to make the point again that there have been clinical studies where they've been studied in human beings. Admittedly, these studies for COVID vaccine is most likely the biggest studies, but there have been studies for messenger RNA and also viral vector proteins. If you go to clinicaltrials.gov, you can see some of the messenger RNA studies. Even for cancer therapy, you will see that there, so they're not entirely new.
Okay, sorry, I think I believe you did answer this one. Can someone, but it came again, can you still get COVID if you took the vaccine?
Yes, as we said, there is a smaller possibility you have these breakthrough infections, especially in light of the variants, but taking the vaccine reduces the chance of getting severe COVID, critical COVID, where you end up in the ICU. And that's why we encourage people to take the vaccine.
Okay. Another question, can we depend on other people getting antibodies naturally to get herd immunity? Tell us about herd immunity first, sorry.
Yeah, so herd immunity is where most of the people in the population have antibodies to that particular virus or bacteria to prevent it from spreading. So you can get this either through getting the disease or getting the vaccine. Now let's look at what is happening in India. If this SARS-CoV virus 2, if it continues the way it does, most of the population, we are praying to God, and our prayers for our brothers and sisters in India, their God just carry them through this time. So this virus continues the way it does in India, most of the people would have herd immunity, meaning they would have been exposed to the virus and developed some antibodies. But when you look at the TV and you see what's going on in India, do you think that anybody would want to go through all of that in order to get herd immunity? Now, granted, there are some people who would may not get severe cases of the virus, of the COVID-19. There are some people who would not get severe cases. But look at what's going on in India. People are dying, and it's just a terrible situation. I don't think that with the disease, there's some diseases which are not so terrible, so that if you get them naturally, it's okay to get herd immunity. But with a disease like COVID, which has such terrible symptoms, I think that we probably should not say, let's just all get it naturally so we have the herd immunity. Vaccinations can help us in that. We don't want to put our communities through that. We saw the surges in Brazil, in Italy. We're seeing it now in India. We saw it in California, in New York. You've probably seen it where you are or had seen it. I don't think we should want people to go through that in order to get this immunity. The vaccine is providing us a way out through the grace of God.
So, and I'm glad you said that, because another point came in, which I'm going to read in a second, but I'm glad that you said, because when we hear herd immunity, and I know a lot of you've seen those on the internet pushing herd immunity, what we don't think about is someone means people in your community are getting sick, very sick, some not making it, and that's how we're going to get herd immunity from everybody at some point having COVID, and some of us might be okay, but do you want to be the one that will be sick to give your community herd immunity? So I'm glad that you said that. And another question came in similar. How far away are we from herd immunity?
Herd immunity. So it's, you know, so I guess the different countries would have different rates based on their population. I know some of the countries like Israel, they are really, if you look at the number of vaccination per 100 persons, they're on the better end of the spectrum. So the CDC is actually a really good website. You can go there and you can see countries, you can see like how many people were vaccinated, so you could kind of estimate like the different countries, and so you know what that is looking like. So for each country it might be a little different, but I think we are not quite there yet. Definitely would have to be over 50%. I don't know if I can give a particular percentage like 70%, 80%. I'm not too sure, but definitely I would believe it has to be over 50%, in order to kind of reduce the scourge of this COVID-19.
Okay, sorry, I was just reading some questions here. Another question, which I think is a very good question: are the COVID tests 100% accurate? And I'm going to add also, because I know that's one of the things I heard, that they're lumping any flu-like symptoms. When you do your COVID test, they're saying it's COVID. So this person's asking if the test is 100% accurate.
All right, so no test is 100% accurate. The PCR, the viral PCR, which is the test for the genetic material, the PCR, is more accurate than, the rapid antigen tests. But we do know that there could be instances where you get false negative, meaning that the person has the disease, but the test is negative. For instance, if I am collecting the sample and I don't insert that swab far back enough, I can get a test that is negative, but actually I have COVID. Also, maybe in the way the test is run, you can also get a false negative. So there are instances of false negative, but generally the PCR test tends to be very, very good in picking up cases. But again, you can have that. So that's where we sometimes use clinical judgment. If the patient has certain symptoms, exposure, and it's negative, you probably can test again just to be on the safe side. So clinical judgment also plays a part with testing.
Okay, thank you for that. Another question, and we're wrapping up. So if you have questions, guys, let's get it in quickly. My employer said we have herd immunity in my employer said we have herd immunity in the workplace. Is that possible?
Well, if the people in the workplace, if you attend in the workplace and you just stay in your workplace and you don't leave, maybe that's your bubble and it would work. But the thing is, I believe that you would leave your workplace and you would go to your home, and other people will go to their homes and interact with other people. So say the 10 people in this workplace had the disease before, or they had the vaccine and they have immunity. In that office, that's a bubble if they don't leave it ever. But because they interact with other people, I'm not sure if I'm saying it correctly, but let me start over. What I want to say is that once you are moving from your workplace to your home and other places, as long as there are people there who have not had natural immunity or immunity from the vaccination, I wouldn't really consider that herd immunity. Herd immunity, is when you have the vast majority of the population having antibodies or having memory cells primed because they had the disease or they were vaccinated. So in essence, just in a workplace, I don't see that as being herd immunity. It probably be considered a bubble if you're staying there and you're not leaving there for months on end. I'm not sure that's what was meant by that question.
I'm not sure either, but they can clear up. And I don't know what profession the employer is by, coming up with this theory or that the workplace will have herd immunity. So I'm not quite sure, but I hope that answered the question. And if it didn't, probably you can just elaborate a little more. Guys, Dr. Alexis, anything else you want to say?
Yeah,
If we have no more questions. Oh, hold on. There's one more question. 1 second. Can it be the other way around, negative but positive? Okay, so I guess they're asking, can it be where the test can be negative but you're positive?
Yeah, so you're saying, yeah, so I could have COVID and I go and I test and it's negative. So I have COVID, but I am positive for COVID, but my test is negative. Maybe it wasn't taken properly. Maybe there was some in handling or processing it. There was some kind of a discrepancy or problem, different things. You can have that where it's false negative, meaning it's negative, but it's false, it's incorrect. And then again, you're asking the other way around, could I not have it and then it turns out positive? I mean, again, these things can happen. You can have in processing, you can have different things happening and you can have a false positive, but tends to be not as severe as a problem, false positive COVID test, meaning that it's positive and it's not. So what I can say, you can have a positive test, but it's not necessarily reflective of active diseases, meaning that if I have a mild case of COVID, 10 days from now, I should not be infectious. But in, say, 20 days, I may still test positive. So that test is positive, not because I'm infectious or can still spread it around, but it's just representing virus in my body, which is replication incompetent. Okay.
Another question, if someone has COVID, can they take the vaccine? I think you had answered that before, but can you just,
yes.
If someone has COVID, can they take the vaccine?
Right. So when you get COVID, your body produces natural immunity. It's believed maybe for 3 months. I read an article that says, I think it was last night, it may be a little longer, but maybe for sure we can say it's about 6 months for now. We know it may be around for, and maybe possibly longer, 9 months, 12 months. So if I have active COVID now, I shouldn't take the vaccine, but as soon as I recover, my symptoms are better, I'm out of isolation, I can take the vaccine. And the rationale behind that is that we're not exactly sure how long your natural immunity will last. Maybe we may come to understand that it actually is lasting for a year. We would hope so, or 2 years. I'm not sure, I'm just speculating. But the vaccine there is like an insurance policy, just in case it's not, the natural immunity is not as long as we were hoping to. We have something there to boost up our immune system and prepare us for COVID. And again, this is especially so with the variants, because there have been some cases of reinfections with the variants. Thankfully, not a whole lot, but some cases of reinfection, yes.
Okay. Thank you, Dr. Alexis. Another question, what do you think about the CDC allowing fully vaccinated people to go maskless? That's something in the US. I read this week, it may not be something that would happen in Canada anytime soon, but can you answer for US viewers?
All right. So the CDC, looked at different studies and looking at how effective vaccination is. There was different studies among healthcare workers where they saw that vaccinations, well, I was kind of just pausing to see if I can find the actual study. Let me see what we got here. Examples of studies. There was one in JAMA which looked at reducing incidence or new cases of COVID in healthcare workers, 6,700. And there was another one from MMR, that's a morbidity and mortality weekly report from the CDC, which shows here that of 3,950 healthcare workers, frontline workers for a 13-week period of time, that there was a decrease in COVID cases. After the first dose, it was 90%. Sorry, let me just make sure I'm reading this correctly. Sometimes you can't even read your own handwriting. That's a shame, eh? But here we're seeing that after the first dose, 90%, and then second dose, 80% reduction. And so the studies have shown that the vaccination is working. So the CDC analyzed that and believing that, saying that, you know, for people who are vaccinated in certain circumstances, they can remove the mask. We will see how that goes. You know, as the CDC director acknowledged herself that we will see how that goes. It's based on the evidence we have here as to how COVID is actually being reduced by vaccinations. And so that's why the stance was taken. But as the director said, from the reading and so forth, that we will see how that goes. You know, hopefully good things happen, continue to happen, and hopefully it does not, we don't have troubles. I'd probably just leave it like that. Yes, trouble in terms of, you know, human behavior.
Thank you. I think someone sent back, they wanted to clear up, they wanted to know, can you be negative but test positive? Can you be COVID negative but test positive? I think you answered that in terms of handling and so forth, but can you be negative with COVID but tested positive?
Yes, so that can happen, you know, as we said, there's no test that's 100% perfect. So, you know, testing, handling, things like that, these things happen. So there are cases, as I said, it's not a whole lot because these PCR tests are very accurate. So it's not a whole lot, you know. Sometimes, you know, you meet a lot of patients who like, for example, have no symptoms, and when it comes positive, they say, do it again. That's not so. And so we have these cases, but there can be cases where you do not have the disease, not common at all, because as we said, no test is 100%, but, you know, there could be a case 1 or 2, you don't have the disease, and for some reason in the handling, processing, something like that, something happened and it comes out positive. But again, there's always some people who have no symptoms but are positive and find it difficult to understand and to digest that. So that's another thing to keep in mind.
Perfect. Okay, so I have one question that came in and we're going to wrap up. So we'll take about 2 or 3 questions max. So I'm going to ask this one and then 3 more questions max, and then we'll wrap up. So Dr. Alexis, I thought I asked that one, but the question is, if someone has COVID, can they take the vaccine? So if they currently have COVID, can they take the vaccine?
No, when you are suffering from the COVID, no, you don't take the vaccine. Even if you're suffering from a moderate to severe illness, that may not be the best time. But after you have recovered from the COVID, you're out of isolation. So, you know, maybe, you know, 10 days from my diagnosis, I'm out of isolation, I've recovered. If I want, I could take it. Now, some people say, well, you know, I will have my own natural immunity for a few months. So I'll wait a few months. I'll wait like 3 months and then I'll take it. You know, somebody wants to take it directly after, that's okay too. If they come out of isolation, they want to take it, that's okay too.
Okay, I think you're off camera there, Dr. Alexis.
Oh, so sorry about that. Yeah.
That's okay. So it doesn't seem like any of the questions are coming through. So I'll just ask one more. I know we have long haulers, right? So people who are long haulers, can they take the vaccine? Is there any benefit to them taking the vaccine?
Yeah, so long haulers are these people with these persistent symptoms, chest pain, dizziness, shortness of breath, and so forth. They would fall in the category of people who have had COVID before. And again, people who have had COVID before, they're also recommended still to take the vaccine. So long haulers, we don't consider them to be still infected. They have overcome the acute phase, but they're suffering residual side effects, the after effects of the virus. So as with anybody else who has had COVID, they are eligible to have the vaccine too. Like if you just have a mild case, you're eligible to have it after a period. And so these long haulers too.
Thank you. So it doesn't seem like there's any other questions. So we're going to wrap it up now. If you have any questions, this is the moment because it is live and I will wrap it up. However, if you have a question that pops up after, you can send it to my WhatsApp, put it on the chat, and I will definitely forward it to Dr. Alexis. I want to thank you very much, Dr. Alexis, for being here, and thank you for answering all the questions. I know you were in a live show again today, so you're in the hot seat a lot. So thank you though for your expertise. Anything you just want to tell us in wrapping up? Anything you want to tell the viewers out there?
Yeah. I just want to, thank you for taking the time to be here with us today. I just want to encourage us, just to do the best we can to take care of our bodies and to pray that God would give us wisdom to make that correct choice regarding that. I take the vaccine, the 2 doses. And as I said, I did it because I believe God gave wisdom to the scientists, and it's safe, effective from the trial. So I took it, and I'm encouraging people out there to go that route. But you know what? At some point, we're on the WIDU trial. We always like to always like to look to the future. After COVID is done, and by God's grace, and we want to just encourage us all to have that trust in God, so that after COVID and all the stresses and trials of this world are all done, we can have that assurance of being with God forever in his kingdom. Because, this COVID is not going to last forever. We are grateful to God that he has promised to come back and redeem us and bring us to a better place when he comes again. And so we hope you get the vaccine, but, even if you don't, but we hope you do. Even if you don't, let's all make that plan to see God and be in his kingdom when he comes again. God bless you real good in Jesus' name.
Thank you very much. Thank you, guys. Thank you to all my viewers. Thank you for all the questions. Thank you, Dr. Alexis, once again for your time. I know you've been very busy, but you got us in here. I just want to shout out Sandy too. Sandy, thank you for sending the questions my way. And Steffi, thanks for sending questions my way too. And thank you, everybody, for just making it interactive. And, truly, I know this is a tough time for everybody. I had my apprehensions too. I looked at your show, I looked at the video we made and prayed, and I took my vaccine too. I got Pfizer. I feel okay. I was nervous still, but I believe and I trust in God, and I believe your words to Malar. I do, Dr. Alexis, I do believe you are inspired, and I want to thank you for that. So thank you to all of viewers. I think one question just came in, guys, and this will be the last one. What is it? Sorry, one question came in. Is it possible to become reinfected?
Yeah, so as we said, we believe that you have immunity after the disease for, 3 to 6 months, about 3 to 6 months, like that. And evidence is circulating that may be longer than that. So reinfection within the first 3 months is thought to be like very, very rare, very rare. But with these variants coming out of the UK and Brazil, South Africa, and India, we have cases of reinfections. Again, that's why we recommend vaccination even in patients who have had COVID-19 before.
Okay, sorry, I was reading the chats. I believe we got all the questions. Thank you, guys. But as I said, if you have any questions after Dr. Malak, Alexis, I'm putting you on the spot. Are you okay if I send you some questions, via WhatsApp? If anybody has any questions after this?
Yes, we're happy. We are here to encourage ourselves to do the best we can for our health. I one of the things I like talking about too is how we can boost our immune system naturally too. And I'm just advocating again for that plant-based diet that can help us staying away from the sugar, staying away from these processed foods. Because sometimes we may be on a plant-based diet, but it's highly processed food. So we have to make sure and balance it out. So I hope this information was good. Let's stay away from the myths and the misinformations, and remember that God loves us so much. And I wanted to say one other thing about this mark of the beast thing with the COVID vaccine. God is a God of love. Would a God of love allow his people to be deceived into taking a vaccine and then getting trapped? Here is the mark of the beast. We know that clearly in the last days, people are going to have the opportunity to make a conscious decision about whether they would obey God or whether they would not. God is not going to allow his people to be trapped and make a decision over a vaccine and then their soul is lost. This is not how God operates. He's a God of love.
Thank you very much. And thanks for putting in that, yes. And I do believe that. And to me, the conspiracies are there, guys, the deceiver's way of getting to us. But, remember, God has not given us a spirit of fear, but of power and of love and of a sound mind. So with that, we'll wrap up. And thank you once again. Thank you to all my viewers. I believe she answered all the questions. Someone saying you did not answer, is it possible to become reinfected? But you did answer that. So,
yes, it's possible, especially with the variants, it is possible.
perfect. So thank you once again. Thank you to all my viewers. Thank you for all the questions. Thank you, Dr. Alexis. And guys, as I said, send the questions after. If you have them, I'll forward them on to her. Remember to like, remember to subscribe, remember to pass them to a friend. Remember, if you have a story to share, please send it away at WeDo, W.E.D.O, Women Empowerment, Define Odds. Thank you. Goodbye.
Amen. Bye. God bless you all.
Thank you.
Bye.